Good morning. Welcome to the AIA webcast on school readiness in infants and toddlers affected by substance abuse and HIV. This webcast is sponsored by the Abandoned Infants Assistance Resource Center, which is funded by the Children's Bureau and located at the University of California at Berkeley. The Abandoned Infants Assistance Program is administered by the Children's Bureau, provides grants for services designed to prevent the abandonment of children and address the needs of infants and young children affected by HIV, AIDS, and/or parental substance abuse. Currently, the Children's Bureau funds the Resource Center and 17 service projects located in 12 states and the District of Columbia. Today, increasingly, as we learn more about brain development and the importance of early intervention, these projects and others throughout the country are striving to ensure that the young children that they serve are prepared for school. Today, you will learn how 3 different AIA projects are working toward this goal. So I'd like to introduce our 3 speakers this morning. We have Cynthia Sloan-Wells, who is the Director of Child and Family Development Programs for the Santa Cruz Community Counseling Center in Santa Cruz, California. Ivy Gamble-Cobb, the Executive Director of the Family Center in New York City. And Khalil Zania, Vice President of Broward Operations for Family Central, Inc. in North Lauderdale, Florida. So I'd like to turn the mic over to Cynthia now. Thanks.
Well, thank you so much for having me today. It's been great visiting with all of you and getting to know the project a little better. We've partnered now with Primeros Pasos in the our AIA project since, I think it's been about a year. And it's been exciting for us and a wonderful opportunity. So it's been great to see all of you here. Today, what Amy's asked me to do is not only address our particular project, but also just briefly to talk about the importance of school readiness. And it's obvious to me you all understand the importance of school readiness, but there really is a push now for a wide variety of agencies, especially agencies that are working with young children, to be cognizant of how important building a plan for school readiness and being able to address some objectives that you have within your own vision around what it is that you're doing for children. So I just came back from Baltimore where the Head Start Bureau did a whole conference on school readiness. And of course that's kind of Head Start's thing. That's what we're supposed to be doing. But I think what it demonstrated is that there's kind of a collective consciousness that those of us who are working with at-risk families really need to come together and perhaps form a language, a common language, kind of a common idea about the importance of school readiness and how it is that we can fit that in and weave that into our services that we're all providing. So I just wanted to give just a brief summary of why school readiness is really important. So we know more today, as you well know, about brain development and the importance of school readiness than we ever have before. The first 5 years of a child's life are incredibly critical. The first 3 years are even more critical. The earliest experiences and environments set the stage for the future development and the success in school. And I really can't stress that enough. And the early experiences influence brain development. I think the word influences is a little mild. I think it does more than influence. And I have a couple of just facts to really highlight that. 75% of a child's brain develops after birth. A toddler's brain is twice as active as their caregiver. Now, I took care of my 3-year-old niece last week, and I can tell you that I think twice is probably pretty low. I'd say she was going at least 5 times as fast as I could possibly go for anything. And that scientists estimate that the brain connections can increase from 50 trillion to 1,000 trillion in the first 3 years of life. So to me, that speaks to a lot more than just being able to influence. It sounds as though that it is really forming what is happening for that child. And that's why it's so critical for us. This is just a graph that really demonstrates the impact that a mother's education can have on a child's ability to do well in school. And it just, again, sort of supports the idea that in order for children to do well, they really need to have environments that support education. And you can see, it's pretty clear. I don't think this graph shows you anything that you didn't already know, but it does help validate that it is important for us to keep this in mind. So the National School Readiness Indicators Initiative have looked at 3 basic pieces. They're well aware that too many children are entering kindergarten with physical, social, emotional, and cognitive limitations that could have been minimized or eliminated by early attention to child and family needs. Now, as I've looked through all of the information on the programs that you have, all of them have assessments that they're providing for children and wonderful opportunities for referrals for early childhood programs, and that's great. And I think that what we really need to do is support the idea that all children, need assessments, that we really need to understand where it is that these children are developmentally and how is it that we can support them, and by individualizing those services. Ongoing research also confirms that children's readiness for school is multifaceted, encompassing the whole range of physical, social, emotional, language, and cognitive skills that children need to thrive. And I believe that this really addresses the idea of partnerships, community partnerships, looking in your communities for other agencies or other sources of information. We can't always be the only source in town. I think oftentimes in Head Start we end up feeling that way. But the idea that other agencies can provide these kinds of services, or that we can combine to make sure that our services contain these things, is really important. But we can make a difference. We absolutely can impact this. I don't know of anyone better than the folks in this room that can have such an impact. The family, schools, and communities must provide environments and experiences that support physical, social, emotional, language, literacy, and cognitive development of infants and toddlers. What this speaks to me of is that level of partnership, that we can come together, we can form a common language, we can look in our communities. Marian Wright Edelman said that if we don't stand up for children, we don't stand for much. And I think that's really true, and I think that as communities, we need to step up to the plate, and who better to be in a leadership position than all of you. Quality early care and education results in a child's school readiness and reduces the need for special education, results in an achievement gap, a less of an achievement gap, and produces an estimated 7 to 10% return on investment. One of the pieces that I always talk about when I'm addressing communities is that early childhood education is an investment. It really is an investment in the community. It does pay off. It does pay off in terms of fewer social services being needed down the road. It does pay off in all of those early childhood pieces being addressed before the children go to school. So the economics of early childhood are important to note. And efforts to improve school readiness are most effective when they embrace the rich cultural language and language backgrounds of families, that is done in a cultural context. Again, you all know this, but it's really good to remind ourselves how important it is and that we are always sharing that information. I think the strongest piece, though, of what it is that they've found is the strongest effects of high-quality early childhood programs are found with at-risk children, children from homes with the fewest resources and under social and economic stress. These are our families. These are the families that we serve and the children that we are trying to help. And we have the opportunity to impact these children's lives more than anything else. So I just, again, school readiness, we all know about it and it's important, but I think it's just a good reminder of just how important that it really is. So now I'd like to just segue into talking about our particular program and the partnership that we have with Primeros Pasos. For those of you, I'm sure all of you know what Head Start and Early Head Start are, but I'll just briefly go over that. Early Head Start is a program for low-income infants and toddlers. It's part of the Head Start Bureau and administered out of Washington, D.C. Washington, D.C. is the mothership. And we enhance children's physical, social, and emotional and intellectual development. We assist pregnant women to access comprehensive prenatal and postpartum care, support parents to fulfill their parental roles, help parents move more towards self-sufficiency. So, Early Head Start provides a full continuum of services, and I've noticed that all of your agencies provide similar services, and I'm sure you're probably sitting there going, yeah, well, we provide all of those things. So what can a partnership do for us since we already do it? Well, I will tell you. Community partnerships play a key role in serving pregnant women and very young children. Strong partnerships that begin with a shared vision and clearly defined roles and responsibilities of each partner. So what Early Head Start and Head Start can bring are multiple resources, training, professional development, facilities. We bring a lot to the table and are excited about sharing it. And really, it is a big part of our mandate. So it's not like we're doing anyone a big favor. We can maximize program resources. We can reduce the likelihood of duplicating services. And I do want to address that just a little bit, because when people are saying, well, we do that. Early Head Start, our mandate is to ensure that children and families are getting these services. It's not necessarily our mandate to provide those specific services. So in our particular case, there really is no need for duplication of services as long as our case managers and home visitors are working well together, communicating, addressing the needs of the family, and really seeing each other as partners. And then make community services more family friendly. Excuse me. So wraparound services, I know yesterday we were talking about high fidelity wraparound services. I'm just talking about wraparound services. But the family preservation service is geared to meet the total needs of the family through the use of community resources, concrete services, and counseling. So the idea is to utilize all the resources that are in the community and bring them together, and that fabric weave the safety nets that I know that all of you are utilizing. So Primeros Pasos, which is funded, provides services to 45 pregnant and parenting substance abusing Latinas in Santa Cruz County. And you have to admit, this is the cutest picture you've ever seen, right? I mean, is this a darling little guy? I'm in love with this little man. So 20 of those mothers are also served by Early Head Start. So when we had the ability to file for expansion grants through the AIA, through the ARA money, we wanted to target specific populations, and substance abuse was one of those that we wanted to partner and be able to provide these services. So in our grant, we wrote for $85,000 for a full-time nurse that we provide for Primeros Pasos. So we also, she provides consultation to our 2 home visitors. The 2 home visitors are Early Head Start employees. They follow Early Head Start guidelines. They are definitely part of the Early Head Start community. However, their services wrap around Primeros Pasos and are tailored to the mothers that they are serving and the children that they are serving. So they look at the treatment piece as the centerpiece, and then the early childhood services are wrapped around that. So we also provide a part-time supervisor and coordinator that is active in the Primeros Pasos program. and resources, education, and individualized client services. So Primeros Pasos and the treatment program really is the centerpiece, and then all the early childhood services are wrapped around that particular piece. So we use the home-based model, which, as you saw yesterday, is evidence-based and is very effective. We have 2 home visits per weekly home visits and 2 socializations per month. So that is the early Head Start model. So we follow that. We are true to the early Head Start model throughout all of our services. We coordinate with the treatment team and the Primeros Pasos staff on a regular basis. We have an MDT meeting that happens once a month. We have a steering committee that happens once a month. And then the staff connect with the Primeros Pasos staff, our early Head Start staff connect with the Primeros Pasos staff on a regular basis. So we are assisting our families with housing, childcare, and social services. However, if for some reason the case managers are working on that with families, then our staff can step back from that. We have 7 different programs. We also have a fatherhood program. We have a housing specialist. We have a lot of services that the Primeros Pasos staff can access anytime that they need to. I think it's really important that our home visitors become trained, so we've been trying to send them to as many trainings as possible. Chris and I were just talking about the fact that keeping them in that loop and really tailoring what it is, their services, for this specific population. We provide child screening and assessment, family strengths and needs. Our curriculum is Partners for a Healthy Baby, again, and it's an evidence-based home visiting curriculum. Postpartum depression assessments, establish of a medical home, that's really big for us. It's primary that not only the mom but the baby have an established medical home that they are comfortable with. We have a prenatal program, parent involvement. Head Start is very big on parent involvement, and so the families, in fact, one of the families that we are using as a case study here is in our policy council, which is an advisory and shared decision-making board that all Head Start programs have to have, and so she is in that. Nutrition, dental screenings, literacy, and school readiness. So similar, I'm sure, to the services that you provide. You know, maybe one or the other we have more emphasis on. So the case study that I wanted to just briefly, I don't know where I am, but just look at is a woman by the name of Candace, and she arrives in her last trimester of her pregnancy, and she's received sporadic care. The first thing that we do is establish a medical home. That's primary for early Head Start. We assess her stress level and help to reduce anxiety. We can do that as part of the Primeros Pasos team, or we can do that individually depending on where she's at. We prepare the other children for the new baby. Really critical to take the SIBS into account when you're looking at a new baby. We encourage her to attend childbirth classes, whether she needs transportation, what she might need for that. We support her in that. We look at her, we do a nutrition assessment and kind of look at where is she on that. Does she need food? Does she need resources? We're working with the housing authority to identify more permanent housing. We coordinate with other community agencies to provide what they need to welcome the new baby. So, and then we offer socialization. And the socialization piece, I think, is really important because twice a month, all the families that are on that particular caseload get together and they can chat and talk and, you know, do what new moms like to do. And it provides some a kind of a normal environment for this pregnant mom, and offers her the opportunity to meet other parents that are really focused on the same thing. And then we always, throughout any of our services, are coordinating with PP. So our goal is to not duplicate any services whatsoever. So Candace has her baby. It's a boy, adorable. We only have adorable children in Watsonville. And so our services continue. For the baby, we do the pediatrician, the things that you would assume that anyone who's working with newborns would do. For the mother, we're referring to a lactation specialist. So our program really gears in now. We're really looking more and more specifically at the baby and making sure that mom has enough support. So our goal in all of this is working well and working together. So we have the Primeros Pasos project, we have the children and the families, we have Early Head Start, and I have to say that there's kind of an error here. It should say fathers. We have a huge emphasis on including fathers in our program, and any of the fathers that would be involved in Primeros Pasos or would want to have some more support would certainly have that available through our fatherhood program and child and family development program. So, but we believe that this partnership strengthens both our programs and provides both our programs with additional resources that we might not necessarily have otherwise. And we are partners in preparing children for school, for getting them ready, for being able to assess how they are, being able to track them over a period of time. Once they leave Primeros Pasos, they are still involved with Early Head Start, providing them with yet another safety net. So I want to thank you very much and appreciate, again, being here, and hope that I have an opportunity to see all of you again soon. Thank you.
So good morning. Again, I'm Ivy Gamble-Cobb. I'm the Executive Director of the Family Center, which is in New York City. And our mission is to strengthen families affected by crisis, illness, or loss to create a more secure present and future for their children. We believe that every child deserves an answer to the question, who will take care of me? And that's regardless of if mom is living with a life-threatening illness or has a substance use issue or is incarcerated. Every child wants to know that they will be taken care of. Our services are really geared to wrap around the entire family. Briefly, in terms of our family and youth programs, that includes our AIA-funded program as well as our child welfare programs. In terms of medical case management, we're providing health support services for families impacted by a range of illnesses, including HIV, cancer, and diabetes. We're fortunate to have a legal staff that works with our families around the future care planning for children, but also other legal issues, housing, benefits, advance directives. In terms of our supportive counseling services, we have a team of social workers who provide individual, couple, family, and group intervention. And lastly, our research and evaluation, which is really evaluating the efficacy of the services that we are providing. We use a multidisciplinary approach where all of our staff work together as a team to provide these services to families. Our social workers, our medical case managers, our family specialists, our social workers, our early intervention specialists, everyone goes into the home working together as a team to provide these services to families. We believe that when families are dealing with very complicated issues, the last thing that they also need to do is to coordinate professionals. And so we see that as our role. Our motto is that we are pleasantly relentless about pursuing and engaging families in services. And again, our services are home-based, they're free, they're confidential, and we serve all 5 boroughs of New York City. Now, in terms of our AIA-funded intervention, which we call Early Support for Lifelong Success, or ESLS, it targets children between the ages of 0 and 7 who were perinatally exposed to HIV. And the goals of the program include preparing these children for school, increasing parental involvement in their education, and helping parents maintain a safe and stable home environment. And we use a variety of interventions, including a comprehensive assessment of the entire family, early childhood intervention, school advocacy, referral for more intensive services, play therapy, and parent and caregiver workshops. So the typical family that we see in ESLS are primarily single women of color, African American and Latina, who are living with HIV. The average age is mid-20s, and most mothers were referred for services, who are referred for services learned of their diagnosis at the time of their pregnancy. The average age of the index child is about 3.5 years old, and other issues that are impacting the family are immigration. Many of the women that we serve are undocumented, language barriers, domestic violence, isolation, and undiagnosed mental health issues. This is a genogram for one of the families that we are serving. Jay is a 25-year-old HIV-positive single mother. She has a 4-year-old daughter, and she's currently pregnant with her second child. She lives alone with her daughter. She receives some support from her biological father, but is disconnected from her biological mother due to a history of substance use. The father of her 4-year-old and her unborn child is not involved, although some might say he is somewhat involved since she is pregnant. The family was referred to our program from her primary medical care provider because she was concerned about her 4-year-old's development and behavior. Specifically, the 4-year-old was hyperactive, unable to focus even for short periods of time, and was overly attached to mom. So she came to ESLS to get assistance with having her child formally evaluated. Mother was also involved with the child welfare system because there was an allegation of abuse against her. And she was also interested in formalizing a future care plan for her 4-year-old daughter and receiving counseling around her HIV diagnosis and other issues that she was dealing with. So when you look at our ESLS intervention, it's divided into 3 primary phases: our initial assessment, the actual intervention, and then the final assessment. And it's a 12-month period that we are working with families. And in our initial assessment phase, we categorize our assessments into 4 different categories. The child assessments, which include the ASQ and the ASQ-SE, which is really doing a very thorough assessment of the child. We have our own pediatric and case management assessment tools that we've developed in-house. In terms of evaluating their home environment, we are using the home assessment. In terms of parent assessments, we're using a depression scale, and we also are using medical and case management assessments that we again developed in-house. And then in terms of assessments of the entire family, we're using the protective factors survey as well as the AIA intake. So our interventions target the parent child, we target the child, we also target the parent, and then we target the child and the parent as a dyad. So in terms of our child-focused interventions, we're doing individual play therapy, we're monitoring their developmental progress, and we also have play therapy groups. In terms of interventions that are focused on the parent or the caregiver, it's support for the school application process. We have a school readiness workshop series that we run. We're, of course, doing the permanency planning to make sure that all of our children are secure, providing them with individual counseling as well as legal clinics to address the legal issues that they present with. In terms of the child and parent dyad-focused interventions, we're doing infant massage, a Read to Me program, Sign a Song, where both the parent and the child are learning how to use sign language. We have an Only Make-Believe Theater workshop, which really serves to empower and inspire children using theater, as well as exposing the entire family to different cultural events. Now, in terms of Jay and her family, what we did was her daughter was involved in our Only Make-Believe program. She attended our play groups, which help increase her socialization, her independence, and her sharing skills. Both mom and child were involved in our Sign a Song program, which helped increase verbalization and parent-child attachment. In terms of working with mom and preparing her child for school, we made referrals to the neighborhood Head Start programs. Mom attended our school readiness workshop, which included sessions on how to prepare yourself and your child for school, helping parents understand the structure of the Department of Education in New York City, what their rights were as parents, and the difference between public schools and charter schools. We also gave mom some tools that she could use at home with her daughter, math, reading, and writing tools, and again, we continue to provide ongoing counseling to her. Additional services that this family was able to access included our medical case management, where we were really concentrated on ensuring that mom was accessing and maintaining herself in high-quality care. We also have a mentoring program for children and youth, which pairs them with adults for relationship building. Again, many of our families are experiencing legal issues not related to permanency planning, and so our legal department is able to work with them. And lastly, our preventive services, which are focused on at-risk children and youth. And these services are available to all of the families who are a part of the ESLS program to complement the services that they're receiving through that program. So in terms of outcomes, the 4-year-old child now attends a local Head Start program. Despite mom's initial concerns, the child was found to be performing age appropriately after that formal evaluation. Mom is engaged in individual counseling. The family is participating in our family and group activities, and mom is learning different ways to bond with and appropriately discipline her daughter. We're continuing to work with the family on the finalization of that permanency plan and to help mom prepare for the birth of her second child. In terms of some of the results that we're seeing in ESLS, our intakes are detecting that 15 to 30% of the children have at least one developmental concern. Over 50% of the caregivers are either depressed or have experienced domestic violence, and we find that these children are more likely to score in the problem range on our assessments. In terms of outcomes, we're seeing that age-appropriate skills and home environment quality remains stable at termination, and also that there are fewer social-emotional developmental problems at termination. So in terms of our next steps, we are focusing on enhancing our assessment tools with sections specifically focused on depression and domestic violence. We are training our staff on domestic violence, caregiver depression, and how this affects young children. And we are providing early childhood development trainings to the collaborating partners that we are working with.
Good morning. Khalil Zania with Family Central in Broward County. Family Central is a comprehensive human service, child care, early care, and education operation founded 40 years ago. Our vision is to deliver services so great that every child and family succeeds. We integrate services based on the needs of families, looking at working with the child directly, working with teachers in early care and education settings, and then working with the parents or the guardians. We'll serve over 130,000 children in 3 counties. My county that I work for and where Cherish a Family is situated is Broward County, Florida. Unfortunately, featured on Policewomen of Broward County quite often and cops, but that's not what Broward County is all about. In Family Central, we operate subsidized child care programs. We've been doing that for over 30 years. So we'll serve about 11,000 children in subsidized child care. And one thing that's interesting in Florida, and I think it's the right thing to do, is they prioritize care for children in protective service. That means that while in Broward County we have an 11,000 child wait list for subsidized care, and mom and dad will wait almost 2 years to get care, if you have a protective service situation, that child's prioritized, and we get them in care. We work with child care providers directly to increase the quality. We know that in child care settings, there's varying levels of quality. We get in there and we train the teachers, we give them tools, we give them mini grants, we help increase the quality to improve child outcomes. And we'll work with about 200 child care providers in Broward County each year. We've got a lending library, early childhood education lending library that serves teachers and parents. They can take out not only books, but also games, toys, educational materials to use in the classroom. Resource referral services, we offer developmental screening. We'll screen over 7,000 children this year in Broward County alone, using the ages, stages questionnaire and the social emotional component as well, to make sure that we're flagging those developmental concerns early and making the appropriate referrals. So again, our services are really clustered around parents, guardians, early care education settings, and working directly with children. Quick overview, Broward County, very large area, 1.8 million residents. We're the 6th largest school district in the nation, 260,000. We have about 1,100 legally operating child care centers and homes in Broward County. One of the real strengths of Broward County is its diversity, also presents some unique challenges. We've got 173 countries represented in our school system and 53 primary languages. So as you can see, we've got a challenge in terms of reaching mom and dad in their language and culture. Our high school graduation rates, not something we're very proud of, but I think you see this is an unfortunate trend in urban areas throughout the country. 3 to 4 out of 10 children will not graduate high school. And we think we know the reason why, and that's that early intervention that may not be happening consistently. In terms of children entering kindergarten, we use a couple of measures to take a look at that. And coming into kindergarten using a measure which looks at letter naming, phonemic awareness, listening comprehension, and vocabulary, almost 1 in 3 children were determined to not be ready for kindergarten. And that's a major concern. So when you see those high school graduation rates where they are, I think we know where we're missing them. Cherish the Family came about at Family Central because the families told us they needed it. We were working with thousands of children in the protective service or child welfare system, and we saw them kind of languishing, sitting there for many years. So looking at this opportunity, we developed the Cherish the Family grant with the idea that if we could work intensively with the parent, the guardian, the child, using attachment theory and a number of other interventions, we could hopefully reunify that family, knowing that mom or dad is that child's first teacher, and will have a higher likelihood of success if we can reunify that family. Collaboration with a number of community partners has been critical. We're looking to make sure that the child has the highest likelihood of success by integrating and collaborating with other service providers. And a unique characteristic of Family Central is kind of leveraging all the services we do on the school readiness side. So we're working with those children and families in the school getting subsidized childcare. We're working with children and families in voluntary pre-kindergarten, and we're working with hundreds of childcare providers where our children are going to spend 7 to 10 hours a day. So that was kind of a unique characteristic that we thought we could bring to the table to ensure the child's success. Cherish the Family Services includes intensive work and intervention with 50 families, therapeutic parenting, a transdisciplinary, collaborative, strength-based care management approach. The families we work with have case managers all over the place. We try to use a care management approach to try to integrate and bring everything together to the level of the family. We use Circle of Parents to help parents form social support networks. And it was just this past Monday I had the opportunity to participate in one of our Circle of Parents workshops. And this is the real heart behind the data and the numbers of these programs. We had 5 families there, all in different stages of working, of being in the child welfare system, having children removed. And we had one family that, in a matter of 6 months, with our great staff's help, mom and dad had been in prison because of substance abuse, lost 5 children between the ages of 2 to 10. And they were there that day with their children, having been reunified in December, offering testimony to the other families about how they can do it too. And we had a mom in there that was released from prison 2 days ago. We had a number of families in different stages of kind of getting back on their feet. So it was amazing to see parents taking the leadership in this Circle of Parents talking about, kind of that motivation piece. You can do it. We did it. We were in prison less than a year ago. A lot of parenting and life skills training, frequent supervised child visitations, understanding that attachment is key. We worked with our local child welfare agency and said, yes, you're getting, mom or dad together with the baby maybe once a month, once every couple of months. We don't think that's enough. So we're facilitating that when we can, almost weekly, and we think that's critical. Navigation of the child welfare and judicial systems is just complicated. It's very complicated once you're in the system, figuring out where to go and what to do next. And just ongoing counseling and support 24/7. I've got the greatest staff in the country, and they're available. They give up their personal lives to make sure these families are successful. This is the integration of services I talked about. Working with those parents, providing family support, working with even if we have to, working with the parent and guardian in the interim before that child and that family is reunified. Working with child care centers, and this is something where we're attacking it on all sides. We'll work intensively with about 200 child care centers in Broward County, roughly 20% of them, and they are categorized and selected by the fact that they serve children that are very low income, and they have a preponderance of children in the child welfare system at those centers. So our idea there is that teacher is going to be a critical person in that young child's life, and we're giving her the tools, the skills, the grants if she needs it in terms of, or he needs it in terms of purchasing curriculum or educational materials. We're helping them get accredited, improving their quality, the idea being if we can improve the school's quality, the teacher's ability, then that child will have a higher likelihood of success. And then working directly with children. Like I said, we work with about 7,000 children this year, either doing the ASQ ourselves, helping mom or dad do it, or helping that child care provider do it. And when flags are identified, we do a more intensive screening using a Brigance, and then if that shows some real concerns, then we work with the school system, other service providers for more intensive interventions. I talked about the quality improvement technical assistance today. We have a whole team of coaches, about 20 coaches outside of this grant, but working very closely, working with those child care centers. And they look at standards of where children should be at 4 years old and incorporate that education and training and information into their work with teachers. One of the programs we were able to integrate, and the idea kind of fit so naturally with Cherish the Family, is positive behavior support. We're working intensively with 30 child care centers, again, those with children in protective service in the child welfare system and of low income. And it's a pilot we're working on. This is the second year where we're using evidence-based approaches, including I can problem solve and conscious discipline, to ensure a child's positive social and emotional development. One thing we've learned is if we don't get the child early and take a look at that social and emotional development, they have a shaky foundation for that literacy and education. So we're trying to work intensively early on with children and teachers and their parents to make sure that that foundation is there. Key to positive behavior support is the parent meetings. We engage parents and guardians of these children at the child care center. We do dinner meetings, and we use the curriculum Raising a Thinking Child to reinforce lessons learned in the classroom. Cherish the Family is strategically situated with in our Family Support Services Department to ensure integration with our positive behavior support and other programs that are working with child care centers and developmental screening. So we have one person overseeing that set of programs to make sure that that synergy exists. In looking at the effectiveness of the interventions in the classrooms, we take a look using the teaching pyramid observation tool for preschool classrooms, and we take a look at the effectiveness of the interventions that we're doing in the classroom, whether it be teaching the teacher, model teaching with the teacher, whether it be working directly with a child or working with the parent during our parent meetings or intensive interventions. We do have the ability to go out through the child care center, through referrals, to go out and do home visitations and make sure that child is on track. I'll tell you that I'm real proud of where we are, but we've just begun the journey. When I think about service integration, even within my own agency, it's a challenge. It really is a challenge when you have funding streams, state, federal, local, foundation. Even internally, it's a challenge. So that's the key thing is kind of breaking down those silos and making sure we're integrated. Again, we've done it by situating like programs in one department, and that was key for us. The external partnerships, absolutely critical, and our approach has been really just value added. We're showing how families, through Cherish the Family, are doing better than the families without. And I think the preliminary data is beginning to show that. I'm very proud of we've had 4 reunifications so far, and we hope to have many more during this process. We're going to continue to grow the collaboration and integration of our programs, again, looking at the parents, the guardians, the teachers, and the children directly. And then the post-reunification follow-up is key. One of the things at our Circle of Parents meeting that was so compelling for me was the family that was reunified this past December, yet they were on whatever Mondays, April 25th, sitting in a Circle of Parents meeting, providing guidance, motivation, and testimony to other parents. That's the level of engagement. They were pretty much done. They had their children back, and they came in voluntarily, traveled a very far way because Broward County is so sprawling and we don't have the best transit system, but they came a long way to be there that night, have dinner with us, and provide testimony and motivation to other families. So we're engaging the families, which is really exciting, and they're motivating each other. And that's it. I'd be happy to take any questions at the end.
Thank you all. I'm most impressed that you all stuck to your 15-minute time limit. So, I think there were some general themes that we heard from all 3 presenters. Certainly collaboration it seems to be key, and the recognition that no one agency can do all of this alone, or at least no one program within an agency. We heard a lot about encouraging parental involvement in a child's education, helping parents create a home environment that is conducive to education and to learning, supporting young children's progress in their own development and educational goals and age-appropriate development. And in the case of Family Central, really working with the schools, the child care centers to provide training for them on how to work with these families. So we have a few questions. If you have additional questions, please go ahead and write them on the card and give them to Amanda or Aya. The first question that I have is directed to all 3 of you, so we'll give you each a chance to respond to it. There is a focus on parenting and/or support for parent-child relationships in all 3 projects. The question is, how do you document parenting outcomes?
We have documentation that home visitors provide that details what the focus of that particular home visit was. They're following, remember, the curriculum, the Partners for a Healthy Baby, and then through that and through the discussion with the family, they decide what the focus will be, and all of that is documented within the files. So if you wanted to open that file and look at that, what you would see is that, this was the particular curriculum focus, these were the activities, this was the parents' feedback, this is what they thought they would do with that. So it would be fairly extensive. Now, they don't have to write a whole lot because the form is set up to just be reflective of what was going on. So we rely on that level of documentation to help us, zero in on what it is that they're doing with the families.
At the Family Center, we're using an electronic client-level database system that really allows us to capture all of the sessions that our early intervention or social workers or other staff are doing with our families. And it's a very elaborate data collection system where all of the goals that the worker is working with the family on are tied to specific activities, which are then tied to specific outcomes. And we are tracking all of that in an individualized family service plan that is part of that database. And it really allows us to see what dosage of intervention we've provided to the family and the eventual outcomes that family has been able to achieve as a result of those interventions.
I think similarly at Family Central and Cherish the Family, we look at some qualitative and quantitative measures to see how the effectiveness of our intervention is going. And in terms of the quantitative, we look at a couple of parent index scales and stress index and parent-child attachment measures. So we take a look at that to see how that's going. Then there's a lot of observation and working with the family to see how it's going. Ultimately, we want to kind of move them past the child welfare system. So that's also at a very high level. A key of are they kind of following along with the plan that we developed together for them to be with their families.
And am I correct in suggesting that if anybody wants copies of the instruments or the specific titles,
Sure.
they can contact you?
Absolutely.
Okay. So the next question is directed to Cynthia, I presume. Somebody wanting to know if Head Start programs are available to children who live in higher income areas or where families are considered to be in the mid or high income status.
Well, right now, and has always been, the Head Start is focused on providing services to the poorest of the poor. They've just raised our income eligibility guidelines so now that we can do about 130%. So Head Start services are really meant to be focused on low-income families. However, all Head Start programs have about 10% of their population that they can have over, that they'll be over income, or if a child has a disability, any child who has a disability. So if you had a child who was in a higher income neighborhood and had a disability, that wouldn't be an issue. But our focus is definitely low-income children.
And is the disability determined by state definition or?
Yes, it is.
Okay. And the next question also for Cynthia. Using the Early Head Start home-based model, do the 2 socializations per month that you provide include the children being served by Primeros Pasos?
Yes, yeah, the Primeros Pasos caseloads are divided. Each one of our home visitors has 10 on their caseload, and so that family is included and is a part of the program in every way. Their services, individualized services, would be focused on the treatment issues or what was happening in the family around that and working collaboratively. But the Early Head Start piece really is, you're using the same model and families are brought together in exactly the same way. So I think what it does for us is really normalizes the parenting situation, and it really brings families that, especially that are so focused on treatment, it really brings them to a place where they can work on specifically parenting and with other parents.
Great. Are there other questions? There? Wow, that's a first. We've silenced them. So I know Ivy has a train to catch and will be thrilled to end a couple minutes early. So I'd like to ask you all to please join me in giving them a big hand and a thank you for your time.